Well, hello everybody, this is Dr. Corey King from AskDrKing.com. Today is going to be the first video part of a new series that we're putting out there, and this is going to be our Thursday rounds. So similar to being in a hospital where you're going to patient to patient to patient, you're looking at test results and the doctors are all standing around each other basically saying this is what we think it is. I'm going to be doing the same thing with some of my real life patients. So I'm going to share what their history is, and we're going to go through some of their symptoms, and we're also going to review their laboratory test results, and then I'm going to tell you what I'm currently doing with these patients that's making a difference. Our first patient today, she presented with her 5 major health concerns were these: weight gain, diet, fatigue. She already knew that she had Hashimoto's disease, and a lot of patients don't already know that. PCOS, polycystic ovarian syndrome, and the 5th goal or concern for her was the overall health. She's a 33-year-old female. When she presented with some of your classic Hashimoto's autoimmune type symptoms. So we've got a lot of adrenal symptoms, slow starter in the morning, the afternoon fatigue, even dizziness when standing up quickly, afternoon headaches. She had a difficult time falling asleep even. And then we get into some of her thyroid type symptoms, and through the roof was the tiredness and the sluggishness, the cold hands and the feet all over, gaining weight even on a low calorie diet, very difficult bowel movements. She was going, I think it was between 7 and 12 days originally is what she was telling me as far as her bowel movements go. Crazy, just crazy. Only one bowel movement in 7 to 12 days, oh goodness. Depression, lack of motivation. She had some morning headaches. They weren't that severe, but she was having some. A little bit of thinning hair, and then the mental sluggishness. These were some of her main symptoms that she presented with. What I did originally, and this is what we do for every new patient, is we ran some blood tests. And I'm going to show you what these blood tests look like. You're going to see there's green, yellow, and red. Red is a value that's outside of your doctor's traditional laboratory range or a reference range. What you got to understand where they get those values, and it's the population that goes in and gets blood work done, and they come up with a bell curve of all the data, and they're comparing you to all these people that go into the labs. Well, I don't know about you, but I don't want to be compared to sick people. Compare me to healthy people. So this is where we jump in and we look at what is called a functional or more optimal range, and that's what's in yellow. So if you go outside of our healthy optimal range, you're going to see yellow. If you go outside of the red, then that is severe. That's the sick world. That's a medication, surgery. That's your traditional medical model is going to live. If we look at the patient's lab results, you're going to see on page number 1, we've got BUN that's a little bit low, calcium that's low, magnesium, phosphorus, globulins elevated. Right there, I'm already thinking digestive issues. We know what her history is, but now that I'm seeing some lab results, these lab results are making me think about leaky gut syndrome, some infections possibly. She's not having normal bowel movements, so we also know she's not going to be absorbing her vitamins and her minerals. Her LDH being really low. When I see that, typically I think about hypoglycemia for patients. Her ALT is low as well. This can get into liver function, but when I see ALT being low, I see more B vitamin deficiencies. Her iron was extremely low at 50. We want to see her between 82, 137. So she's going to be tired and fatigued just from having this low iron level. TIBC being elevated says, hey guys, we have some low iron. We're raising our hand to tell you that. Give me some iron. Hemoglobin is low as well. This is what's carrying oxygen for her. On page number 2, we're looking at the different white blood cell markers, her neutrophils, lymphocytes, monocytes, eosinophils. Bacteria marker is elevated at 67. That's her neutrophils. Monocytes just say, hey guys, there's an infection. We're not quite sure what it is, but we're just letting you know. Eosinophils being at 4 say, hey guys, there's a parasitic infection. Now this is what we were always taught. Eosinophils get elevated if there's a parasite or a major allergic reaction. But what I've seen through the years is that this parasite marker also runs hand in hand with candida, which is fungal overgrowth. If we look at her triglycerides, her cholesterol, her bad cholesterol, all of that's through the roof. We don't want to see that. HDL, that's her good cholesterol, that is lower than what we want to see. So if her good cholesterol is low, she's not going to be able to repair her body. She's not going to be able to make hormones very well. That's what we use cholesterol for. Her thyroid panel, my goodness, her TSH is through the roof. Her T4, T3, free thyroxine index, T3 uptake, free T4, free T3, and reverse T3 are all significantly low. What you need to understand about this patient is she actually stopped taking her thyroid medication about a month and a half before getting this blood work done. So she's not on thyroid meds. Could that contribute to some of her fatigue? It very well could, but when she was taking her thyroid medications, she felt worse, and she kept going back to her doctor. Her doctor had her on Synthroid levothyroxine, which is a T4 medication. She kept going back to her doctor and saying, "Doctor, I'm not feeling well on this medication. Can we try Armour?" She was wanting to get a little bit of T3 in there, and the doctors refused to allow her to try Armour. They should have done that. We also see her TPO antibody is elevated. Anything above 99 is going to say positive on my lab test. Her thyroglobulin antibody is 1,131.20. Again, through the roof. This is classic Hashimoto's disease. We see her iron saturation is at 12. Her vitamin D, her 25OH vitamin D, the active form, is at 18.9. Severely low, severely low. That's going to contribute to some of her energy loss as well, along with not supporting her immune system to go after these infections. Her homocysteine is starting to get elevated, so automatically we're starting to think about some genetic mutations impacting her MTHFR genes. Their CRP, C-reactive protein, is getting elevated as well. Yes, that's a cardiovascular marker, but this is a younger female. I'm more concerned about this just being an inflammatory marker, not that she's going to have any cardiovascular disease right now. But with the triglycerides being elevated and her cholesterol being elevated, that is going to become a concern if we can't get this stuff down. So I saw the basic blood markers, but on this patient, just like most of my patients, I always order a nutritional deficiency test, but that also checks for candida and dysbiosis. So on this patient, sure enough, just like I mentioned on the eosinophils being elevated, her candida markers were elevated. So this is on that first page that I'm showing you here. This is numbers 1 through 9. She has 2 that are through the roof, which is number 7 and number 9, and she has number 1, number 2, number 4. These are also starting to get elevated. These are metabolites that are telling us, hey guys, there is a candida overgrowth. So then we start to look at our bacterial markers. And so we're looking at how much bad bacteria is there versus how much good. This is called dysbiosis in this patient. So her bad bacterial levels are elevated while her good bacteria levels are low. So just from this information here, seeing that she has candida, she has the overgrowth of the fungus, she has overgrowth of bad bacteria, she doesn't have enough good bacteria, she's severely low on her thyroid hormones, her vitamin D is extremely low, she's not methylating properly, and she's also anemic. That right there is going to explain her energy loss, some of her thyroid symptoms, some of her adrenal gland symptoms as well, along with some of the lack of bowel movements. What did I do for this patient? Well, we also ran her genetic testing. We'll get into that at another time. Let's just stick to this right now because this is a handful. So as I told her, she has lots of layers that we've got to dig through. So we immediately started her on a candida protocol to start killing off the candida overgrowth, lowering the bad bacteria levels. Typically, wherever you see candida, you're going to see parasites. That's just my clinical experience, and her eosinophils were elevated. So right there, we're going to give her an antifungal, which is also going to be an antiparasitic and an antibacterial herb. So we're using natural products for this patient. So we started killing off her infections, and then at the same time, we start re-inoculating her gastrointestinal lining with good bacteria, and we're patching up the damage of her intestinal lining. 80% of the immune system is located right there in the GI tract. So for this patient, she's already feeling better. Her energy's coming back. She actually went out running, she told me today, with her dog. Her sleep is better. It still isn't perfect yet. We're still working on that. But her energy's there. She's having daily bowel movements, and this is something that she hasn't been doing in a very, very long time. We haven't addressed her thyroid yet. I've been working on these infections first because all these can impact the thyroid. Yes, I realize her TSH is through the roof. She was already feeling crappy on her thyroid medication. She's actually feeling better now that she's not on her thyroid meds But what I'm going to do is as soon as we finish killing off these infections, we're going back and running her thyroid markers, and we're going to look at her white blood cell panel. At that point in time, if she does need some thyroid help, we are going to help support that thyroid, and I typically will use a natural glandular that's heavy on the T3 side. We're going to check her white blood cell panel, make sure these infections have worked their way out of there, and then we're going to start to work on her genetics. So that will be the next video. We'll show you what her genetic mutations look like. I'll go into a little more detail about some of the nutritional deficiencies that she had. But as of this point in time, we're almost 2 months in, and she's feeling really, really good. This is a great success story. So the reason we're doing these rounds is so you can see some of the tests that I run on patients. Because if you do not do in-depth testing, you're going to miss some of the pieces of the puzzle. So for this gal, nobody had been checking her for these infections. Nobody had been even looking at anemia. Nobody's been even looking at those pieces of the puzzle for her. So she's feeling well. And so this is what I encourage all of our patients to do, is make sure your doctor is running in-depth testing to give you as many answers as possible so you can complete your picture. Because when you have more answers, you can come up with a more thorough game plan. We'll see you on our next Thursday rounds.